Hello everyone, please contact Professor Robert for a sample or a customized paper of the following or any other assignment. NR603, Week 6. Mental Health Clinical Presentation Part 1. Description. Total points possible. 60. Requirements. For Week 6 of the course there will not be a case study given to you by the faculty. Instead you will be assigned a mental health disorder commonly seen in primary care, and you will create a case study based on that disorder. You may create a case study either from a previous clinical patient experience, or if you have not had a patient in clinical that represents your assigned topic, you may research your disease using the week's classroom material and the evidence-based literature in the field. The case should be clear and include all elements of a normal case that might be presented in class: subjective, objective, assessment, and full 5-point plan. The clinical practicum documentation will be helpful for this process, or notes you have taken in clinical regarding cases. The case should be clear, organized, and meet the following guidelines. Week 6 Part 1. This part goes in Part 1, and should begin with subjective and objective data just like we do in your weekly case study discussion. Do not put diagnosis until your peers respond. Week 6 Part 1. The case should lead the class toward the mental health diagnosis assigned to you by your instructor. Week 6 Part 1 Specific Guidelines. If this is an actual patient from clinical, include their actual chief complaint, demographic data, HPI, PMA checks, PSA checks, medications, allergies, subjective and objective findings without identifying the patient's name. If this is a fictitious case you've created from the literature readings, you should design an example patient and include chief complaint, demographic data, HPI, PMA checks, PSA checks, medications and allergies, subjective and objective findings. Be mindful that the background data for the case should bear some relevance to the diagnosis. The case should not be overly simple. Like your weekly case studies, it should include subjective data that loosely represents the diagnosis you have been given, but includes some elements of the pathophysiology presentation of the disease. You must include the following elements in Part 1. Subjective. Chief complaint HPI, demographic data, HPI, PMA checks, PSA checks, subjective and objective findings. Next, leading the discussion in Part 1. You must respond to any student who posts regarding your case with a substantial response, either answering their questions or noting their response and acting as leader. You also must respond to any faculty responses to your initial posting. Use references to support your responses. Remember, your response to your peers is part of where you demonstrate your knowledge of the disease you were assigned. You should be discussing hallmark symptoms, diagnostic tools, etc., along with discussing the student's impressions and conclusions. Once your peers respond, you can share the primary diagnosis and treatment plan that actually occurred if it is a live patient, and the ideal treatment plan if it is an invented case. Your treatment plan should address any national guidelines as appropriate for the diagnosis. Thanks for watching.